Okay. Hi, Shannon.
Hi guys.
How's it going?
Great. How are you doing?
Good. Good. Well, we know you very well because you're in our office space, but will you tell us a little bit about you and your business?
Yes. So my name is Shannon Kirby. I am the owner of New Narrative Therapy, and it's a private practice that's in the same suite as you guys, obviously. I started my practice a couple years ago. I have my master's in marriage and family therapy, so I'm a licensed marriage and family therapist. And I specialize in grief and helping people process through a grief or loss experience or like a major life transition. So that's the majority of what my practice is.
Yeah, so we share a lot of clients because that's often when physical things pop up too.
Yes.
Physical
Yeah.
symptoms, right? Just like, and going through like the parenthood journey and stuff. But do you want to tell us just a little bit about like what working with you looks like or like how, yeah, just general therapy, like how does therapy work if someone's never been?
Yeah. So I kind of joke with people that I'm like the least therapist-y therapist out there. And what I mean by that is I'm pretty informal in my practice, and I kind of operate under the impression that all my clients are the experts in their own lives. I'm not the expert, and so coming in and working with me, we kind of go through like the first few sessions of getting to know each other and exploring family history because everybody kind of makes sense in context. And so having context of their past kind of informs who we are in this current space. And so getting family history and just kind of details of your past is important to my ability to figure out what's going on currently. So yeah, the first few sessions are just usually family history stuff. And then after that, it's just kind of whatever the client feels is front of mind. So I don't usually have an agenda. Yeah, like I said, it's pretty informal. But my posture is just being curious and kind of asking questions and noticing certain things that maybe are a recurring pattern or a theme or things that might come up regularly, and just kind of pulling that out and highlighting that.
Yay, love it. That's awesome.
Yeah.
So, like specializing in grief, then does that look any different? Like if someone's coming to you like after a loss or like a big transition, still kind of like starting with like the history component and then like working through, is there like a different process, I guess, for like grief specifically?
It depends on how like recent the loss is and how intense the experience is. So sometimes it's kind of crisis management. I like to use the analogy of like, let's say you're going on rapids and you're like currently in rapids and like we need to get through the rapids before we can kind of dive down and see what's happening with this current that's always underneath. And so like if there's rapids, you don't necessarily have the capacity to go down and explore the undercurrent. And so if somebody's coming in like the rapid season or in crisis, then obviously we do kind of crisis management first and figuring out what the support system looks like, coping skills, and those types of things. And then once things kind of settle and the person has more capacity to maybe do some exploring of history, then we can go do that. But yeah, like I said, it's really kind of client informed and what they're needing and less about what I want to do
Yeah,
for them. So yeah,
yeah. And we feel that for sure.
yeah.
Yeah.
Kind of help us transition that into how that looks for like how that can look for parents in general about the different types of things that can cause grief within parenthood, not just like loss of lives, but like
Loss of,
expectations, different
Totally.
traumatic events that they go through during labor delivery. Like, how does that
Yeah.
work with your patients or your clients?
Yeah. So, I don't know if you guys have ever heard this phrase or no, there's like a poem, I think, but it's about how joy and sorrow are sisters.
mm,
And it just talks about how those two things kind of go together. So, like on a more intense scale, like if you've lost somebody, let's say you've lost a parent and you get married and it's like a super joyous occasion, but then right after it's followed by, oh, and my parent's not here. Or like you have your first kid and it's like, oh my gosh, I'm having my first kid. Oh, and my parents, so it's like this high of the joy, but then paired with the sorrow. And I feel like parenting is a really similar experience to that because it's like such an intense experience. You're getting to know your kid in this specific stage that they're in. And then right when you figured out they like move on to the next stage. And you're like, oh, I'm missing that version of them that they were, but I'm loving getting to know this part of them. And that's just kind of always happening. And so it's really important to be able to hold space for both things. Like it's okay to like miss that version of your kid that you knew and be sad about the toddler stage when they needed you, whatever, and then really enjoy getting to know this new part of them. And so a lot of people coming in who are parents, and especially with young kids, but I mean, even in any stage, it's like giving people permission to acknowledge both parts of the experience, and acknowledging that as a grief experience, because that's like a bigger thing. Like a lot of people don't even identify something as grief.
Right.
Yeah, that's a whole different thing. Yeah.
I mean, totally. It's like, I feel like that's a lot of just, yeah, life in general is like
Mhm.
grieving. Like, I don't even just like something I didn't really expect transitioning into parenthood was just a loss of like my own independence. I didn't even, I mean, I just didn't expect that because I'm still
Yeah.
like who I am, but I just like remember, I mean, it also like COVID happened around the same time, but I was just like, oh my gosh, I can't just like leave my house. It was like a big transition moment.
Yeah, and I think it can feel a little complicated sometimes because depending on your journey to parenthood and the people around you's journey to parenthood, if you say like, "Oh my gosh, I missed this part of myself," we almost feel guilty like, "Oh, I by me saying I miss this, is someone going to think that I'm not appreciating this thing that I have?" And like there's just this really tricky balance. Like both things can be true. Like you can miss
Mhm.
that independence or that version of yourself because you do become a completely different version of yourself when you have kids. You still have access to the old parts, but there's all these new parts that are there. And so it can feel really complicated sometimes to like acknowledge both things.
Totally. Yeah. Do you have, I know this is like individual for the person and I don't want to get into like your specific, um, but do you have like general like coping skills that work pretty well for people as far as like transitions or grief experiences that um are like kind of a theme for you, or like when you see clients where you're like, okay, these are like some of the like general techniques or things that work for people?
Yeah, so like first and foremost, I think it's important to be able to like identify and acknowledge that what you're going like to name what you're experiencing. So if that's grief, then grief, or if it's anxiety or fear, whatever the thing is, but being able to like pause and make room and like notice what you're feeling and then name it, because we can't really um take the next steps of like using our coping skills or moving forward if we haven't even identified like what we're moving forward from.
Yeah.
That's kind of like first thing is just creating space to notice and then name what you're experiencing. And then I think in these seasons like parenting or grief or loss or something, like having a support system or people that you trust, and can be like to show up as yourself, like having spaces where you can show up as yourself, I think is really crucial to being able to like successfully move through some of these major life experiences, because we're not meant to do these things alone.
Yeah. Yeah. Cool.
Can we rewind just like a tiny bit and have you just like define grief?
Yeah.
Because I feel like you kind of like, how can we name something? Like it took us a long time to like learn the definition of what is trauma, like what is it actually like. So I feel like we're using words like grief, and I'm like, okay, but
Yes.
it's not
Yeah.
just you lost a loved one. Like there's more things that are encapsulated in that word.
Sure. So I'm actually just going to read you the proper definition of grief so we can all be on the same page.
Perfect.
Yeah, because you're right. There, people do use grief and bereavement interchangeably. So the definition of grief is deep sorrow, especially that caused by someone's death.
Okay.
And so I think that's a pretty intense definition. It also informally is defined as trouble or annoyance, which I think is interesting. But I think societally, we all have different ideas of what grief is. So I think our first instinct is like, oh, you lost someone. But grief can be so many things, like losing the idea of what you thought your life was going to look like. So that whether that's like having a partner, not having a partner, building a family, what building a family looks like, how you build your family. And so if it turns out differently than you thought you would, or than you thought it would, then there's this process of kind of letting go of those expectations and then renegotiating what your life looks like and kind of being able to show up in that way. I mean, it could be the loss of a relationship. So somebody that you thought would be in your life for a long time, and then they're not anymore, whether that's a rupture in the like friendship, or they move, or you outgrow the friendship. I mean, there's so many different levels to our grief experience. I mean, it could be moving away from your like hometown or your support system. Yeah, there's so many different things. Like, what comes to mind for you guys as you think of that?
I mean, lots. I feel like, I mean, there's just different, like, I don't know how to like word this question, but I just think about like just my own experience of like losing, like having Lydia, and then at the same time COVID happened. So like my whole life changed where like I didn't have my job that I was supposed to go back to. Then I had like the kid, and then you couldn't leave the house really.
Yeah.
And so then that's kind of like when Wellcore was started, because I was like trying to figure out a new like life path, but I don't know that that was like my wisest, I mean, obviously it's all worked out, but I don't know, like
Sure.
looking back, I'm like, okay, that was clearly like a trauma moment of like, yeah, grief and stuff. So I don't really know how to ask that question in general of just like, how do you, I guess, in a healthy way, like because I do think like obviously everything worked out, and I'm so glad that like I did the things that I did, but I don't know that I wasn't the healthiest version
Yeah.
of me. But I
That's
guess
so
therapy,
challenging.
I
That's so challenging because it,
that's
like, on the
really
one
tough.
hand, it's like time is going to pass either way. And so you might as well continue moving forward and making progress. So, like, I can use myself as an example. So I had started grad school and then was 1 year in and then had my first kid. And so I like stepped away from school, took a break, moved, had another kid, and then moved back to Kansas City with the intention of finishing school. But right when I moved back, COVID happened. And so that was in March, and I was supposed to start back up in August. And like everything about our life changed. So, like, new place. My husband was starting a new job in a new industry. I was going to be starting back to grad school. Everything was shut down. And then a few weeks before school started, a family member died in my husband's family. And so it's kind of one of those things where it's like, well, do we keep moving forward as planned, or do we need to pivot? And we both kind of agreed, like, time's going to happen either way. The first year is kind of a blur. When you lose someone, everyone kind of blacks out. So I might as well have my master's at the end of that year. And so, like, we look back at that, we're like, oh, that was a little chaotic, but it turned out okay. And I think what was really important about that time is we had an incredible support system. Him and I were on the same team and kind of checking in regularly. We were both in therapy. Like, we kind of, like, although it was a chaotic season and chaotic decision, we both kind of armed ourselves with the things that we knew we needed to be able to manage and get through. So I'm imagining for you that was similar, like having a supportive partner,
Yep.
feeling equipped to like run your business, all those things. Like, you had enough kind of stored away to be able to like successfully launch that, even though it was a little chaotic and maybe not like the best timing. Does that fit for you?
I think
there?
so. I mean, I guess maybe like in summary, like you can't prep for these like chaos, like you can't prep for
Right.
grief, but you can in the sense of like doing the things, like if you haven't been through like maybe a bigger traumatic grief moment, like doing the things like already having a therapist or already having like a support system in place and like things in place, then it like gives you a better chance, like not chance, but like it helps you get through in a way that like grieving process of like you have in a more successful way. Does that sound? I
Yeah,
don't
well,
know how I'm
it's
saying
almost
that.
like, I don't know. I use a ton of like analogies and
Yeah.
metaphors in my practice, and I usually just make them up, and it's kind of hilarious. But I'm thinking of like starting a road trip on a like an empty tank versus like a half tank.
Yeah.
It's like,
Yeah.
you're not preparing for something terrible to happen, but if something happens, you're prepared. And so,
Yeah.
like, if you have some gas, that's like the equivalent of having maybe an established relationship with a therapist that you're not seeing all the time, but you check in once a quarter or whatever, or like having a community that you're a part of, or close relationships. It's like having those things established is so important, so that when something comes up, you're not like starting from scratch or starting on
Right.
empty.
Yeah. Love it. Yeah.
Yeah.
That makes a lot of sense. So
I feel like that's true of like almost any healthy, like
yeah,
we
totally.
exercise,
Yeah.
you know, because it prepares us for what our life is going to bring with us. And
Mhm.
we, you know, like take care of our immune system because you're going to encounter a germ, you know, like all
Yeah,
the things.
it's so applicable. Or even like with going back to health, like having established care with like a doctor and maybe a cardiologist and all these different people, because if something comes up, you don't want to then be like scrambling to try to like get in with someone or find, like having established things is so important to being able to move through something. I don't want to say successfully, but
Yeah.
successfully is kind of the word that's coming to mind.
Maybe like just in a way that doesn't, I mean, because it's chaotic regardless. And like, I don't think I look back and think like, oh, like, I don't know.
Maybe it like helps to not have it move as much into trauma because you're
Yeah.
not so overwhelmed by the
Mhm.
grief and how
Yeah.
that's like being like is grief, but like it's not so just like burying
Yeah, sure.
so that
That
it
makes
becomes less, it's
Mhm.
held as less traumatic.
Yeah.
Makes sense.
Maybe.
Yeah. We're all just figuring it out, guys.
Yeah. This is why I love these conversations though, because I learned so much even just like about myself and like in general, just like about just, I don't know. It just, I think you think about like the health side of things, like your physical health, you have like a primary care physician and you have like
Right.
all these things and like because you need that person in your life. And then same thing I feel like with therapy of like, or that's I hope where we're kind of getting to as like a society, like it's more normal to have like your mental health kind of check-ins and like someone that's like there, like you're taking care of that side of it too. So then,
Yeah.
So I feel like that makes sense. Whether or not success is the right word, it's helpful to have someone to fall back on when something happens.
Yeah, definitely.
Help you work through it. Yeah.
Yeah.
So kind of going back to like support system, like family dynamics, I guess, talk to us about, again, I don't really have like a good way to like ask this, but like how do family dynamics, I guess, play into you, how you process grief or you can give examples or just like in general.
Yeah. How much
That's a
time do we
loaded question.
I know, I'm like,
I'm
family
like trying to
dynamics,
make
oh
it
no.
general and also not so general that it's like impossible to answer, but
Yeah.
I
Okay, so your question is, so how do family dynamics, like what role do family dynamics play in somebody's grief response and process, maybe?
sure.
Is that what you're asking?
Yeah.
Or is that not what you're asking?
Yes. No, that's great. That's
Okay.
correct. Yeah.
So that is very nuanced. Every family kind of has their own culture, and narrative about feelings and grief and all of the things. So, oftentimes in families, we have, feelings and experiences that like are okay to acknowledge and express, and then things that we don't do. So like some families, like we're always happy and we're never sad, and you can also be angry. Or some families is like we're never angry, we never talk about it, we're always happy, whatever. So there's like the bad emotions and the good emotions, instead of just like everything is here for a reason and we know how to appropriately express and handle each thing. So the grief process or any emotional process is going to be kind of dependent on your family system that you grew up in and what was acceptable and not acceptable. So that's part of why the family history is really important when getting to know somebody, because it's helpful for me to know what was appropriate to express and what wasn't. And then kind of honing in on those things and get like a lot of times, a lot of what I'm doing is just giving people permission to like say something, feel something, do something, because we have all these mental roadblocks that we're bumping up against all the time that we don't even know are there. So there's like a lot of permission happening. Yeah, does that answer your question?
Yeah, for sure.
Okay.
Is
Is there
there like I'm sure you see like well between like partners even since you treat couples and family. So
Yeah.
like between partners that's probably different too. So that's probably another like reason why it's so important to set up that care before you go through a grief process because then it's like I mean yeah, definitely. I mean, in my own experience, we definitely had different ways of like dealing with the grief,
Yeah.
stuff.
Yeah,
And
one, I think we think about it with our partner, like when you're getting married and you do premarital counseling or whatever, it's like, okay, what is your narrative about money and what's your family story about money? And so it's like those two things are very different. So how do we negotiate that? And like that is the case for a lot of things, but we don't necessarily think about it from like an emotional perspective. It's all kind of the like practical things that we address first. The other thing about like, you know, I know we're talking a lot about grief, but specifically within a family, like if you lose someone, the whole family system kind of restructures. And it's interesting because although everybody lost the same person, they lose a different version of that person. So like if like let's say the dad in a family dies, like the mom lost her partner, which is very different than the kids losing their dad, and then like the boy in the family losing their dad is different than the girl losing their dad. And let's say someone's married with their own kids, that looks different than this person who's in college, you know, like everything about that experience is different. And so it can be really frustrating or confusing for the family if everyone's having different reactions to the same loss, because it actually isn't the same loss, it's a very different loss. So then thinking about that too, like with some of your patients that you guys are working with, like if they're, you know, going through like multiple miscarriages or inability to get pregnant, those types of things, it's like that's a very different experience for the woman than it would be for the man, and maybe the kids in the family. Like there's just so everybody has a different relationship to that same experience. Does that make sense?
Yeah, absolutely. Yeah, that's so. Are there like, again, I know this is like very individualized to like what each person, like what the loss is and then what each person's like family dynamic is, but are there any like, is there like a tool or like a, I guess a general like question that someone could ask their spouse or someone to just like put that on like a, or it's just like even just knowing that like that looks different, is that alone just helpful to be like to have more grace for the other person?
I think knowing and being able to say out loud some of these things, because that's often what happens is like we don't make the covert overt. So we like have these things and we think our partner can like read our mind, or our partner must be having the same experience as us, so I don't need to say this. And so I think if we can kind of get comfortable like over communicating and over articulating what we're feeling or experiencing, that can often bring people closer together or just let people in on like what your process is. And talking about it from a place of curiosity, like, man, I've really been feeling this way lately, like have you been feeling this way, or what has this been like for you? And just kind of having like grace and understanding and then curiosity when you're going through something with somebody else.
Yeah, that's really good.
I know that I've had a conversation with several friends and my partner about like, hey, have you ever thought about what you think your body's going to do, your brain's going to do if you've gone through grief, and like how would you like me to show up for that when that happens?
Yeah.
And it is different. Like the answers I've gotten, one's like, I'm on a plane to Peru, and she's like, I would love if you showed up in Peru with me, that would be great, but I'm leaving. And I was like, great, I'll show up in Peru, like that's what you want from me. Whereas like I'm probably gonna be like under the bed, under the like in the dark. And I also would love someone to like come and pull me out, where my husband is like, I want you to come into the dark with me and just like sit there with me. And I'm like, I don't want to stay in the dark. So I feel like everyone is kind of has a little bit of a different answer, but it's fascinating to like hear what that's like for everybody. So
interesting.
I'm like, you can't always have that conversation ahead of time, but it is nice to be like that. And then if you are in it, kind of like what you just said, like, or what you said, like, this is how I'm experiencing you, or how I'm experiencing this situation. Can you kind of tell me what?
Now you talk.
Right. Right.
Yeah.
Without like requiring that always, but.
Yeah, I think like it can feel so isolating to be going through something really big. And again, not just specific to grief, but like sometimes we have really big emotions and we don't quite know where to start or how to express it. And so an invitation can feel so nice because it's like, I want to talk to you about this thing, but I don't know how. And so it's not the same as like expecting your partner to read your mind or whatever, but if you have a closeness and intimacy with someone, they can tell when something is going on or whatever. And so just being invited to share like, hey, I've noticed you felt a little off, like whenever you're ready to talk about it, I have room for you. Like that is just such a huge invitation that can feel like take some of that weight off of like, okay, you have room for me when you're ready. Like when I'm ready, I feel comfortable that sharing with you now. The other thing I was gonna that made me think, made me think about you were talking about friends.
We're just both getting emotional.
If someone said that phrase to me.
Yeah.
Oh.
Yeah. Yeah.
Oh.
I feel like
I-
we do that a lot. Like
Yeah.
that's part of our, like when we're in session, like I'm just like, I am here for you and I have space for you. But
Yeah.
yeah.
Well, and like,
that's such a great phrase to say. I love it.
Yeah.
Sorry.
yeah. No, don't apologize for that. That's
Yeah.
part of the deal. I
Yeah.
think like we don't often get to be in spaces where someone has room for us too.
Right.
And so that's like one of the beautiful things about therapy. It's like it's a space where you get to show up and it's a completely one-sided relationship. Like I don't need anything from my clients. And so they get to come in and use the space however they need. And like there's no expectation for me. I have no agenda. And so if someone wants to come in and like take a nap and be by themselves for the first time in 3 weeks, then like sure, take a nap on my couch. Or like, it just to have a space, like I think that phrase is really important. Like I have room for you. Like we don't feel that very often in spaces because we're fighting for attention, we're fighting for intimacy, we're fighting for connection. We're like, so yeah, I think that that might be where that's coming from. But I was thinking about the grief, like asking people like what you would need if you were experiencing grief. It's so great to have that conversation. And oftentimes people have no idea what they need. And like, especially if you've never been through something, like you have no idea how you'd respond. And like something that shows up a lot is like, you'd think that these are the people that I would go to if something happened. And then something happens and you're like, oh my gosh, no, those aren't the people that feel safe, or they don't have capacity for me, or they can't show up for me. But then these people shockingly feel super safe. And it just like, it can be such a confusing and eye-opening time when you go through something super intense to figure out like who has space, who doesn't, and who can like sit with you in the stuff. And so that's something that's interesting that happens, but also we don't always know how to ask for what we need. And so if you're supporting somebody who's going through something intense, I think instead of saying like, hey, let me know what you need, just continuing to follow up like, hey, I would love to bring you dinner this week, like what night works, whatever, and just kind of being proactive about supporting somebody and just kind of, I don't want to say like forcing your way in, but kind of making your presence known can feel really helpful and supportive for people.
Yep. I have a patient who, and she would love that I share this, but she actually made like a really, which I was thinking about. I was like, I should probably just do this now because I feel like it would be a really good exercise. I don't know that it would be right for everyone, but her and her brother lost both of their parents and they were adults, but they, then it's still like, they weren't living with them, but it's still like a pretty traumatic thing.
Yeah, that's huge.
And she made like a big like Google Doc. Let me see if I can, I don't necessarily need to like pull it up, but it basically went through like just how they're processing the grief in general. And then it was like, here are some phrases that are really helpful for you to say to us, or like, these are things that are okay to say. These are things that we like appreciate if you don't say, like, what can I do? Or like those like kind of open, or like at least this, or those like types of phrases. Yeah.
Oh.
But like it was kind of nice.
Wrong.
She just got to like send it to like her extended family. And then even like as her provider, it was kind of nice to receive, because then it was like, these are the gift cards that we like. These are things that are helpful for us. Like we don't necessarily, like if we ask you for a meal and we ask you to drop it off, please don't take it personally. We may not chat. It was just like such a well like thought out like document that I was like, this is so helpful on the receiving end, like to know how to show up for you. And I'm sure I'm like, I kind of want to just do it because I'm like, it also is helpful to know like, how do I process this? And like so anyway, I'll have to like see if she's okay with me like somehow sharing it on or something.
That's really interesting and really helpful. Because I think a lot of people in the supporting role don't know how to move forward, and they don't want to do something that like causes more injury, but everybody's so different. And so like often like I lost my dad several years ago, and I like will have people like reach out to me. They're like, hey, so and so just lost a person. Like, what do I say? And I'm like, I've literally been through this and I don't even know. And I'm a therapist and I work with grief. And like, I don't even know the answers. Like, if anybody were to know what to say, it would be me. And like, I don't necessarily know because I don't know the person, and everyone needs something different. And so yeah, I think being able to like communicate what you need is super important, and being able to receive that and not take it personally. Like, hey, you
Right.
said this thing that wasn't helpful, or I know you offered this, but this would be more helpful. And just to realize
Right.
like it's about the other person. Like it's not about me in this moment. It's about what this person needs.
Right.
And like don't take things personally in
Yeah.
grief.
Yeah. Yeah, it was really, definitely send it to you, Shannon, but I'll
Okay.
see if I can ask her if I can like copy it some without her name in it and share it.
Okay.
It's just really like, it's really cool. I've showed it
That's
to
awesome.
several people going through something, because I'm like, obviously you don't have to do this, but because it's a
But
pretty
they're like,
approach.
can I do that?
Yes, I
They
know,
do the
but
exact
it
same
is,
thing.
I mean, it is kind of like, yeah, it is. It was, I mean, like I said, it was great as like someone, especially someone who doesn't know her like super well, but I've been treating her for a long time, because then I like knew like what gift cards I could send
Yeah.
her and like, things to say to her. And so it was,
Yeah.
yeah, anyway,
Oh, that's awesome.
super interesting. But yeah, is there kind of going into another question, but is there any like misconceptions or stigmas associated with grief that you encounter? I don't know that that's, is there any, I mean, there's probably like a lot again.
All of them. Yeah, I think, sorry, my dog's in here. I don't know if you just heard that. Just getting
I
comfortable. That wasn't me. That was my puppy.
I didn't think it was you, but I was like, what man is like behind you?
No, it's my puppy. Um, no, I think so like we kind of touched on earlier, like some people don't identify certain experiences as grief because they're like, oh, this
Right.
isn't a big enough deal. Just similarly to like trauma, like, oh, someone else has had it worse. So what I went through wasn't
Yeah,
actually
right.
trauma or wasn't painful because this person had it worse. And it's like, well, that's not really relevant. Like everyone's that'd be the same as like I have two kids, and like if one kid broke their femur and then the other kid needed stitches, and they're like, oh well, yours doesn't actually hurt stitches because this kid broke his femur. It's like, well, that's not, people's experiences aren't relevant.
Right.
So I think a lot of people kind of dumb down or mute their experience because
Totally.
it's not as bad as someone else has it or something. And then I also think there's this idea that we like get over something. We expect people to like, okay, it's been this long, now you're done. And it's like, well, that's actually not how it works either, unfortunately. Like it kind of becomes a part of us and we figure out how to integrate it into who we are, where it's not all of who we are, but it's also not in the past and none of who we are. Like it's a
Yeah.
part of our experience and a part of our makeup, and we take it with us as we move forward. And figuring out that relationship with our grief, I think is important, but not something that people acknowledge all the time. It's like, okay, I'm going to grieve and then I'm going to be done. And it's like, that's not how that goes.
Yeah.
I think the like 7 stages or whatever thing kind of feeds into
Oh,
that
yeah,
stigma
for
though, like
sure.
where they're like, you
Yeah.
get through the 7 stages and you're done,
Right.
you
Yeah.
got to acceptance over it, versus it being like, no, those are like things that you're always like in one of those boxes, and like sometimes you're in acceptance, but like,
Uh-huh. And
right,
progress, I mean, just in general, like progress isn't linear. And so to
right,
look
yeah,
at this is like, okay, now I reached acceptance, I graduated, and now I can move on. And it's like,
yeah,
well, no, because then another thing is going to happen that's going to bring this thing up and it's going
right,
to bring you back. And so, yeah, I think the stages of grief aren't always helpful because it's not, yeah, it makes us think it's supposed to be this like linear process when it's
right,
really just an experience figuring out the relationship to our grief. And there's an analogy that I didn't make up, but someone told it to me and it feels like it connects the most with people, but it's the beach ball analogy. I don't know if you guys are
yeah,
familiar with it, but like one way to handle grief is like if you're in the pool and you're trying to hold the beach ball underwater and you're just like, it's fine, I'm fine, everything's fine. This isn't here. I've got it. Everything's under control. And then suddenly out of nowhere, the beach ball flies up, it splashes everybody. It's chaotic. There's wreckage, and so that can be your experience if you're just pretending like you're not grieving and you're trying to like stuff it in a corner and like, okay, I'm done, I'm fine. Then it's going to come out somewhere else and it's going to be unpredictable and it's going to be chaotic and it's going to be painful. But if you can imagine like laying on your back in the pool and floating, and then the ball's floating in the pool with you, and then there's wind, like sometimes the ball is going to be touching you, and that's when your grief is close, and it might feel overwhelming and you can experience it and acknowledge it when it's touching you, but then sometimes it's going to be on the other end of the pool and you can still see it and it's still in the pool with you, but it's not as oppressive as when it's touching you, and you can enjoy those times too when it's far away. And so that ebb and flow, like sometimes the ball being close and sometimes it's far away, I think is a more realistic view of how we relate to our grief as we move forward in life.
Yeah, I love that.
Yeah, that's super helpful.
Yeah, beautiful.
Cool. I didn't make it up, but I do say it a lot.
I usually use a sprained ankle analogy for like everything. So, but
Love it.
I was like like any injury, I'm like if you sprain your ankle over and over again, like the likely when we're like healing from something and like the likelihood isn't like your ankle is still, even if you've been through rehab and everything, your ankle is healed, but it's still more likely to be injured in the future
Yeah.
versus like your right ankle, you know, if you
Yeah.
so, I mean,
Interesting.
not quite the same, but I feel like I used to
No, but
sprain
yeah.
ankle.
Sometimes I talk about blisters too when people like really don't want to talk about something. I'm like, you know, when you have a blister, like you could just like let it exist and it'll callus over, but like it's still kind of going to be there. But we could also pop it, and then the gross stuff's going to come out, and then you could let it heal, and then maybe it'll fully go away. People hate me.
These are one of those moments, Shannon, where I'm like, I use analogies all day long, and I'm like, why? Why do we both do?
Hey, they're so helpful. Like we need to like give it up for analogies for a minute. Man, it's great.
So good.
We love a visual.
Clearly.
Oh man.
So good. Oh man. Anything else you have?
I found goes back because I am not quick enough to do it, but I saved this like post that somebody put about what you should text a friend going through a miscarriage. And it literally has like 4 different options. It's like, I come and pick your kids up and get them out of your house. The next one is like, I send a DoorDash meal. The next is like, you and I go to Target. Or I just send like prayers and good vibes and like, I'm here for you, but like nothing, I'm not gonna like do anything tangible.
Yeah.
Like they can just like literally respond 3.
Yeah.
And you do the 3rd thing on that list that you just sent, and like that it's like simplifies, and obviously it would like be tailored to whoever it was that you're sending it to, but kind of giving them 4 options of like, I am willing to show up for you in one of these 4 ways, which is the most helpful to them versus just being like, let me know what I can do. Anyway,
Right.
so I like had it saved on my phone of like, and I feel like that can be true of any kind of grief thing.
Yeah, sure.
Well, it's funny because I use the same kind of thing for like labor prep when we're talking about like during like labor. I like look the guys in the eye. Usually it's the guys. And I'm like, do not under any circumstance look at someone in physical pain and say, what do you need? Like you're gonna
I need you to get out.
yeah. So I'm like going through before you get to like that moment of like pain and like overwhelm and anxiety, like going through like what are some things that are helpful for you, like if you're sick with the flu, like what are some things, because obviously you've never been in like that specific moment before, but what are some things that are like helpful for you? Do you like touch? Do you like no touch, no sound? Do you like music? Do you like white noise? Like all of those things. And then that gives that partner the opportunity to be like, do you want your music on, or do you want a smoothie? Instead of being like, what do you need? What can I do for you when you're like in a moment? So that's definitely like a very another analogy for us.
I love it. I love it. That's awesome. Yeah, it's so helpful. I think even just like you modeling that for your patients, it's like giving them permission to be more directive about what they need, and then modeling how to have that conversation with the partner. And like they might like, you need to be more decisive or asking questions or whatever, and like it's okay, no one needs to be defensive, this is something that's appropriate and normal, and you're just like starting that conversation, modeling how to do it, giving people examples. Like that's so great.
Well, thanks.
Yeah. What other questions do you have for me?
I've kind of jumped around.
This one.
Yeah. Okay. When like, I guess since I just went over like kind of the things I go over with my clients, but what are some like good stress management tools you suggest, or like, because usually I go through like the 5 senses like for labor and delivery stuff, and then like, what do you like for each of these 5 senses, and like how does that like feel for you? But are there things that like, are there other things I could use, or are there things that you like to recommend for?
So I think a lot of times people are not comfortable like sitting in their feelings. They try to like distract or move through something quickly. And so my kind of first suggestion is always to like sit in whatever's happening. Again, like try to sit in it and not um disconnect, and like then being able to identify what you're feeling and then identify what you need. And so that's a lot of like grounding exercises. So going back to the five senses, but naming, like naming the, or not naming, but going through like the 5, 4, 3, 2, 1. Do you guys do that?
I
Like
think
name 5
that's
things you can see, 4 things you can hear, 3 things you can touch, 2 things you can smell, 1 thing you can taste, whatever. So like
Yeah.
getting out of your head and into your body, and just kind of calming your nervous system. So that's something usually when someone's feeling overwhelmed with any type of emotion, we like start with grounding or like getting outside and in like fresh air, moving your body is helpful. So those are kind of the like really low lift things that people can do. And it's all in an attempt to like get out of your head and back in your body. So then you can identify the thing that you're feeling. And then try to like, once you do that enough, it's like being able to maybe string together like the common factors of like, when this thing is going on, then I feel this and then I disconnect. Where right now we usually just like move through all the things so quickly and we're like, oh, I don't know how I ended up feeling this way. Does that make sense?
Yeah.
Mhm.
Yes.
I don't know if that answers your question at all,
No,
but
100%. Yeah, that's great. I love that. I think that's, yeah, super helpful.
yeah, like I said in the beginning, like it's a lot of just like giving ourselves permission to like sit in whatever's happening and acknowledge what's happening and then feel the thing that's happening, because we grow up in families where like some things are good and bad, and or some things are allowed and not allowed. And so it's like just relearning that like everything's welcome, everything's okay. Let's like figure out what it is and then figure out how to move forward.
Man, it is way easier said than done.
Yeah.
I, yeah,
I
That's why
always
I sit
say-
in this chair and just tell people what to do.
yeah, yeah,
Just kidding.
yeah,
I always use that language when we talk about, I educate people on C-sections all the time, and
Uh-huh.
that's no one's plan generally,
Right.
like at 20 weeks pregnant. Um, and so I always say, like, if that moment comes where the decision is made or is needing to be made to have a C-section, to like take a second, acknowledge the loss of the plan, like
Yes.
acknowledge the
Yes.
grief that is what you plan for this like very pivotal, life-changing moment. Like
Yeah.
it's a big deal. It's allowed to be a big deal. It's a huge change from an expectation. Sit
Mm-hmm.
and acknowledge that grief, even if it's for a few seconds before you then go and have to like have the C-section. But just
Right.
like not just saying like it's fine, it's totally okay. This is, it's always on the table for what could happen. I'm like, no, like this was not what you wanted. This was not
Right.
your plan. This is not what you prepped for and maybe studied for and got education in and all this kinds of stuff.
Yeah.
That's a big change. And so I use that same language of like, let's acknowledge what's going on, accept the word that it is of like, you can have grief over this situation. That's okay.
Totally.
And then
Totally.
it's sometimes then I'm like, okay, if not, you're just shoving the beach ball under the water. And
Yeah.
weeks later you come and see me and you're so upset that you had a C-section. And I'm like, right. Yeah.
Yes.
and
Of
it'll be like
course.
Shannon is
We
next
need
door.
to go see someone. I
Yes.
am wonderful, but like professionals are better.
Oh
By
my gosh. We all have our lanes, I don't know.
yes.
I'm just gonna transfer this session to.
Just have a little buzzer and you just like buzz me in like, hello. Now Shannon, we'll come see you.
Yeah,
Yeah.
I know. Shannon and I have done a joint session before, and we need
10 out of 10 recommend. It was
10
amazing.
out of 10. It was great.
Yeah. Yep.
Yeah.
Good. Well, is there anything, so now that people are like ready to work with you because you're so amazing, what's the best way? So people follow you on Instagram
Yep.
and
So my Instagram is New Narrative Therapy. You can find my website, newnarrativetherapy.org. And you can, reach out, email Shannon at newnarrativetherapy.org. But any of those, website is how to find information about me. Instagram is just kind of information about grief and boundaries and things. yeah, I am accepting new clients. I do in-person and telehealth for anybody in Kansas. But yeah, that's that.
And then if you're a therapist watching this, are you still offering your interior design services?
Office
Yeah.
design.
TBD.
Okay.
Yes, I'm up for collaborations.
Perfect. Shannon also has a wonderful style, so she if you come to our office and think it's beautiful, it's because of Shannon and Rachel, but
I take no credit. If you come to my office and you think it's beautiful, it's because I designed it.
definitely. You did most of it. Rachel did, I think you picked out a lot of the furniture in our office. Shannon's office is all Shannon.
Yeah, this was great. Thank you for having me.
Yeah.
Love it. Thank you so much for doing this. This is great. I learned so much.
Yay.
Just stop recording.
Oh yeah. Okay.